In this series on prognosis, that is the scope of treatment using homeopathy, we will talk about the scope of homeopathy for the treatment of BEP, that is benign prostate enlargement, that is also called benign hyperplasia of prostate or benign prostate enlargement, BPE. Well, this is a common condition in male. Almost 50% of the world population after the age of 50 years in males, they suffer with some form of prostate enlargement, and it is estimated around 60+% after the age of 60 years. This is an enlargement of the prostate gland in males, and this is a benign enlargement that is non-cancerous. However, it produces certain symptoms slowly and steadily. The symptoms usually are frequency of urine, which is more, especially at night. Maybe one may have to wake up 2 to 3 times or 4 times or 5 times at night to urinate. The flow of the urine becomes weak and slow. One may require to exert some pressure to pass the urine. There may be some burning pain if it is associated with additional infection. This prostate enlargement is usually progressive and it may end up giving more severe symptoms eventually. My name is Dr. Rajesh Shah. I am a medically trained homeopath and director of Life Force, where we treat patients of benign prostate enlargement and many other chronic and recurrent diseases from all over the world for last almost 4 decades. I will share my experiences about the prognosis of prostate enlargement based on our experience with around 200 plus cases of prostate enlargement. What is the role of homeopathy for prostate enlargement? I would say homeopathy has definitely a specific role to slow down the disease progression and the further enlargement of the prostate gland. We cannot claim that it will stop the progress completely, but we have seen clinically that it can slow down the progress as well as it can give relief in some of the symptoms, and it can also delay the need for surgery in many cases, if not all. So overall, the success rate is roughly around 30 to 40% where the symptomatic relief is possible. One may delay the surgery or one may completely get rid of the surgery also in some cases. The parameters of improvement typically includes the timely sonography, ultrasound of the prostate and the pelvis on day 1 on starting the treatment is baseline, and subsequently we usually recommend that every 5 to 6 months we should get a sonography report to evaluate the progress, whereby we can see if the prostate enlargement has reduced in size, if the weight of the prostate gland has reduced to a certain extent, and we have to also see what is the residual urine. The residual urine, the amount of urine which is retained in the bladder after passing urine, that also is a very important parameter. If that also should reduce to a certain extent. If we can observe these findings, then it means that the medicine is working, and also patient has to physically feel symptomatic relief as well. What is the duration of treatment for prostate enlargement using homeopathy? I would say the duration is little longer. One may have to take medicine for 1 to 2 years or longer, depending on what response one gets. In case one does not get response at all at the end of 6 to 8 months, if the prostate enlargement increases or continues increasing, then probably one may have to go for surgical intervention. Surgery is a separate art and science by itself. It is also a part of homeopathy. So homeopathy is not averse to surgery. However, homeopathy tries to avoid surgery if possible in some of the cases which are otherwise considered as surgical cases. Prostate enlargement is one of them. Is homeopathy recommended for prostate enlargement? Yes, homeopathy is definitely recommended for all the cases of benign prostate enlargement. Of course, one has to also keep checking the blood test, what is called as PSA, that is prostate specific antigen, time and again to see if there is any development of malignancy or cancer in the cases of prostate enlargement. So I hope this video will help the patients as well as doctors and the medical students to understand the role of homeopathy for the control and the treatment of prostate enlargement. Thank you very much.